Senator Hassan.
Well, thank you, Mr. Chair, and thank you to all the witnesses for being here and for the teams you lead. I know how hard everybody is working. Dr. Redfield, I want to start with a question to you. 43% of the deaths in this country have been in nursing homes or long-term care facilities. In my state of New Hampshire, 80% of our deaths are attributed to residents of nursing homes and long-term care facilities. In mid-May, the White House urged states to complete COVID-19 testing on every nursing home worker and resident within 14 days. A month and a half later, that still has not happened. CDC has since put out different guidance on nursing home testing, calling for a baseline test for residents and weekly testing for nursing home workers. Given the widespread outbreaks within nursing homes and unique risks posed to residents, what is CDC doing to ensure that states carry out the recommendations for nursing home testing issued by CDC on June 13th, and how many states have met these guidelines so far?
Thank you, Senator. We are working in close contact with CMS on that issue. As you say, we're not an enforcement agency. We make recommendations.
But I'm asking, and my time is short, I'm asking what you are doing to keep track of compliance with guidelines. 43% death rate nationwide is huge, and people are looking to you all for granular guidance here. So what are you doing to find out who's in compliance and who's not?
I was trying to emphasize that we're working in partnership with CMS, which has that regulatory oversight. And we're there to continue to reinforce the guidance, as you mentioned, which we think is critical. And we think we do have to get everyone screened in these nursing homes and the employees every week. Unfortunately, we still think that we need to keep visitors isolated from the homes right now, particularly in areas with high jurisdictions. But the regulatory function of this is CMS, but we are really meeting with them daily to see what more we can do to try to ensure that there's greater compliance.
I thank you for that. People are looking to the CDC for not only very clear and granular guidelines, and you've heard that all throughout the questioning, but particularly with nursing homes and long-term care facilities, there's a lot more work to be done, and we are still hearing that they're not getting usable personal protective equipment all the time either. Let me go to another question, and Dr. Fauci, I'll start with you. We've heard discussion already today about the difference in the effectiveness of measures taken, for instance, in Europe and the United States. This is a graph that shows the disparity between new confirmed cases per million residents over the previous 7 days between the United States, Europe, Canada, and Japan. The disparity is eye-popping. Surveys suggest that mask wearing in the United States occurs less frequently than in Europe. You and our witnesses have been very clear on the importance of mask wearing in public places. Do you attribute the improvements in Europe to more widespread use of masks, or are there also other specific government policies or individual behavioral differences that you believe should be incorporated into our national strategy?
It's certainly masks play a role, but there are a number of other multifaceted things in each of those very disturbing graphs that you show. Yeah. One of the things that became clear, when we shut down as a nation, in reality, only about 50% of the nation shut down with regard to other things that were allowed. In many of the European countries, 95% of all activities were shut down. So that is one of the reasons why you saw, particularly in Italy, which shut down to a much greater extent than we did, the cases came way down in a sharp curve downward and then stayed. So it's not only masks, it's the fact that the countries in Europe and the other countries you have there had a much more uniform response. We're a very heterogeneous country, and we had a heterogeneous response depending whether you are in the Northeast, Southern, West, or what have you. So there's a number of other factors, probably some that we still don't even understand.
Well, thank you. And I'm going to move on to just one other issue, and it's really just to urge Dr. Redfield and the CDC to issue additional guidance for schools in particular on reopening. I understand that you are continuing to do that. I appreciate that the CDC has released FAQ, frequently asked questions documents on things like youth sports, which provide more concrete, useful information for families, and I'm hoping that you'll do the same kind of FAQ documents for parents and teachers that directly address practical questions and concerns about school reopening plans, simply like what happens, what should a school do specifically if 1 or 2 positive cases come up in a classroom or in a teacher? What should parents and teachers expect school administrations to do? So we can follow up with that. I appreciate the chair's indulgence.
Thank you, Senator Hassan.